It's down the basement. It's kind of funky basement right there. It's one of the older libraries. It's not like Berkeley where they're changing them all and updating them everywhere. Oakland doesn't have those resources. Step number 3 is a one-to-one health and wellness assessments. This is where we come in to the on-site to the company, and we typically schedule it in 10 to 15-minute intervals where employees receive a blood pressure, health and wellness screening to evaluate and report on their physical, emotional, and chemical stress levels. Testing, going from sitting to standing, measuring blood pressure sitting, and then having a person stand and immediately measuring their blood pressure again is a test called Ragland's test. And it does give a very good screening of the health of the adrenal glands. And because the adrenal glands are so key for a person's health and energy throughout the day, as well as sleep, this is a good screening to find out if a person's under stress. Physically, they may not say they're under stress, but physically their body may be damaged due to long-term stress.
Do you do any hormone testing?
We don't do hormone testing at the site. But if someone's coming in, then we may do additional hormone testing if their pH was really low and their adrenals were really not, their systolic did not rise. Then we may suggest that we do like a adrenal salivary index test or something of that nature. Now, most employers find this particular on-site evaluation to be one of the most valuable aspects of our program. Again, sometimes we will have employees where the employer will send out an email and say, you can go online and fill out this stress survey. And they can create their own number. So we don't even know their name. And then, then we can have a stack of these surveys when we come in. We say, oh, what number did you make up? And then we can pull out their survey. So we already have it in advance. And we can get the aggregate information as well that way. So that's with the stress survey. So, and if you're interested, you want to fill out the stress survey, you can go online to the redwoodclinic.com and look around. On almost every page, there's a place you can click on something and fill it out. And if you put your name and all in there, I will get back to you. I don't always look every week. Yeah.
Do you get your results within at the end of that 15 minute or that day?
Yeah. Yeah. We actually talk to people about the results at the time, if it's confidential enough area. Yeah.
Yeah.
We have like a little screening sheet where we go down, we code everything red, yellow, and green. So that if it's in the green zone, it's green. Okay, everything looks great, so that's good. If they're in the red zone, if they aren't seeing a physician, we suggest that they go in. Or if they need further consultation, we usually negotiate with the company to offer employees a free consultation with our office, where we can go through things in more detail.
Granted, obviously, health conditions contribute to the productivity and all that, but do you ever get into referrals to other places in terms of what the cause of the situation is, like the cause of the stress or the cause of the fatigue or if it's not just due to, weight or, something.
Yeah, if it's, there are physiological factors related to stress, and those are the things that I try to address at my office, or maybe other offices do it. Some companies already, with their benefits package, they do have psychological counseling. They have health plans that cover therapy, group therapy. Some of them have, like I know Kaiser and some of the other groups have meditation programs, and I think probably Annie's also in their gym or something. They offer various classes on yoga and things of that nature. So yeah, there are a variety of different ways to do it, depending on what the company already has or doesn't. So body mass index is one way to see whether someone is overweight or not. It is, anyone heard of Evander Holyfield? Yeah.
The boxer?
Boxer, yeah. And so Evander Holyfield, one of the people I study with is a chiropractor in Texas. And Evander Holyfield is one of his patients. Now, if each of you has a body mass index chart in your notes here. This. And so in this chart, the way that it's set up is we have height across the top. We have weight down the side. And then in the inside is the body mass index.